I want to introduce you to a new treatment that we've been using here at InjectAbility since September of 2024. It's called PDGF-BB, and it stands for Platelet-Derived Growth Factor, and we have them naturally occurring in our body, but a company called Essence has made a lab-manufactured version of this. It's an exact replica of what we have in our own body. It responds to wound healing, and we use it topically after microneedling to help repair that wound that we just created. And that repairing creates skin quality changes that we can't see when just doing plain microneedling. Now, since September of 2024, we've been using it as an unapproved use, and that is by injecting it into the soft tissue, much like we've done in the past several years using PRP. In fact, PDGF is the active ingredient or component in our own PRP, but this is a synthetic version that's a lot stronger. So we've been using it in areas that are not safe to put dermal fillers, like the forehead and the nose, or areas around the face that don't need any more volumetric changes, but there are injured, wounded scars or wrinkles that we want to treat. So we've been having fantastic results. Here are some of our testimonials from patients as well. So I was even sourced as an expert by a national media outlet on the topic of injecting PDGF, and you can read about that here in the Zoe report. Now, what patients can benefit from having PDGF placed into their forehead or around their skin tissue? Patients we found that have lost a lot of weight recently or on GLP-1s or just naturally through the aging process have lost fat into the forehead area. When we lose fat in this forehead, it makes our skin looser, and so every time we animate raising our eyebrows, it collapses and those wrinkles get worse. And it might even look like your toxin isn't working as much as it used to or lasting as long as it did, and that's just because your skin quality isn't as good. So combining PDGF with your neurotoxin is definitely ideal. They help enhance each other. For example, you can see in my pictures that after my Botox, you can see how my forehead looked without PDGF, and you can see on the PDGF side how the toxin lasted longer and the skin looked smoother. So it's an adjunct in the forehead and in the frown lines, and now we're using it around the eyes. You can see it has lifted my eyebrows and smoothed out my forehead bumps and lumps, and also hid that vein that's in the center of my forehead, and that kind of shows up as we get older. But the case I'm going to tell you about now is actually a colleague of mine who developed an antibody to neurotoxins. She's actually shown positive for neutralizing antibody for botulinum toxin type A. Now, this is extremely rare in clinical practice. In fact, for 26 years I've been doing this, I've never had a patient develop an immunity to neurotoxin. But the patients that we are hearing about this happening to are, the one thing they have in common is they've been getting injected too frequently, way sooner than that 90-day suggestion by the FDA. So this resistance can occur when treatments are administered too frequently, causing the immune system to recognize and neutralize the treatment before it can actually take effect. So who do we think of when we think of people who do this? It would be colleagues of mine, other injectors. Because what do we do the moment we have a little bit of wrinkle or movement? We want to use that little leftover in the bottle. We don't want to throw it away. Pop in a few more for us just to make sure that that doesn't get wasted. But what this does is almost like an allergy shot where you're exposing yourself a little bit at each time. You can develop an antibody. So the lesson here is to put all of your visits into one. Don't come earlier than 90 days. But a second lesson to learn about PDGF and how this could be effective for people who have become neurotoxin resistant. This is her before video on the top. Prior to any treatments, she hasn't had any neurotoxins for 8 years. She has full movement in her forehead and also her frown and her crow's. So what we did is we decided to treat her with PDGF to see if we could affect her skin quality so much that it would show less lines and wrinkles. We did notice more than that though. We noticed that it was actually not just changing the texture of her skin, but it decreased some mobility immediately, as you can see in this video, and continued over time. And what these videos are showing is as that skin got better, her results got better. Her skin appears brighter, smoother, and more supple. Her pores are even refined, her brows are lifted, and her forehead and mobility has decreased through this biologic tissue enhancement. So results emerge gradually. Subtle improvement in these fine lines may appear as early as right after treatment because there's a natural influx of hyaluronin. As that hyaluronin will level out, it will almost be perfectly smooth for a day or so. And then the swelling starts to kick in. So for the next few days, it might be tender, have some high points or lumps and bumps. Don't freak out. Those will typically go down within a couple of days. As early as 2 to 3 weeks, you'll see structural changes that are visible, with the most significant transformation around 6 to 8 weeks. Your skin continues to improve quality and texture for up to 3 months as that new collagen matures. But unlike temporary treatments, this creates a lasting structural improvement as your body builds enhanced tissue architecture. the thickened dermis naturally through animation through a process called myomodulation, which makes dynamic movement a little more challenging. Effects can last up to 18 months, maybe even beyond, depending on your own body's collagen metabolism, since we naturally lose about 1% of collagen a year after the age of 30. Retreatment around 18 months might help maintain those improvements. So I chose a novel approach for her. Instead of neurotoxins, which wouldn't have worked for her anyway, I chose to use PDGF-BB injections to the same treatment area. Now remember, this is an unapproved application of an FDA-approved product. It is FDA-approved in therapeutic space, such as orthopedics, oral maxillofacial surgery, and in dentistry, as well as diabetic wound healing. However, in aesthetics, we consider it a complementary and alternative regenerative medicine, and we've been exploring and documenting its remarkable potential for the last 18 months. So PDGF works by enhancing your body's natural tissue remodeling process. That treatment encourages controlled tissue structuring that creates a naturally lifted brow position when done on the forehead, smoother forehead appearance. But unlike temporary treatments, it creates a lasting structural improvement as your body builds enhanced tissue architecture. This thickened dermis naturally limits animation, making dynamic movement more challenging. Since the first few patients are treating the forehead, myself, and temples, we've now added the frown lines, the nose, around the eyes, the upper lid, nasolabial folds, oral commissures into the neck, as well as the hands. We've experienced some amazing results in all these areas. You can see some of those before and afters here. If you think that PDGF might be a good option for you, or you want to extend the life of your neurotoxin, or just enhance your skin without any volumetric changes, please reach out to us. We'd be happy to do a thorough consultation to see if you're a good candidate for PDGF-BB. Personally, I think this is one of the biggest advancements we've seen in aesthetic medicine since the invention of neurotoxin or Botox cosmetic. I only see how it can be helpful. It's not a replacement for Botox, and it's not a replacement for fillers. It's an adjunct. They work symbiotically together to potentiate the effects. If you are neurotoxin resistant, it's a great option or alternative. But most people are just going to benefit from the skin benefit changes, and it will help your results last longer. So hope you come in and try it.